For some Canadians, the decision is isolating and an unjust betrayal.
Somebody is making a choice with my life, whether or not they know it.
Unlike almost all other severely ill patients who can request medical assistance in dying or MAID, health officials announced Canadians suffering from debilitating mental illness legally still cannot.
Let me be very clear. We need more time.
It's an unthinkable scenario for most, but what's next for Canadians who might have been waiting for the option to die?
People are tired of treatment and want an end to this suffering.
Right now, even Canadian doctors are divided.
I wouldn't say that I have advice. I would hope that they could keep trying. And, I think that there are many interventions.
If a person has been under treatment for 30 years and is still sick, to me, that's pretty self-evident that their condition is not treatable.
It's incredibly painful to live without connections.
44-year-old Agatha Gowron lives in Regina. She suffered from depression since the age of 13, along with anorexia and bulimia. No treatment has meaningfully worked. All she wants now is compassion and acceptance.
I really wish that people would understand that some individuals are okay with not wanting to be helped and don't expect it. I would like to have control over their life and how they leave or what they leave behind.
Gowron says she doesn't want to take her own life. She wouldn't want someone to find her and feel guilty about what they did or didn't do. She'd hoped MAID could offer a more dignified ending.
I feel honestly like I'm running a marathon and somebody keeps moving the finish line.
It has been a long road. Currently, medical assistance in dying has 2 tracks. First legalized in 2016 with safeguards, Track 1 refers to a request for MAID by a person whose death is reasonably foreseeable. In 2021, MAID expanded to include Track 2, requests made by a person whose natural death is not reasonably foreseeable, but are suffering from grievous and irremediable conditions. Additional safeguards include a minimum 90-day assessment period, expert consultation, at least 2 medical assessments, and information is offered on available ways to alleviate suffering. Patients suffering from mental illness alone are not allowed on either track.
The vulnerable are very much underrepresented.
Retired psychiatrist Derek Smith says this is about politics, not patients.
This idea that we're protecting people is spurious. These people do not need protection. They are competent Canadians who can make a decision themselves.
The number of reported MAID deaths in Canada has seen a steady increase, going from just over 1,000 in 2016 to over 13,000 in 2022. Access to MAID for individuals whose deaths were not reasonably foreseeable beginning in 2021 accounted for less than 3.5% of patients.
We don't have a special category for stroke victims or kidney disease or cancer or anything like that. We have a special group for mental illness. And that, to me, is evidence of the ongoing stigma that psychiatric patients face over their entire life.
I'm not ideologically opposed to MAID for mental disorders.
Dr. Madeline Lee is a MAID assessor and provider. She feels the delay is a chance to develop more detailed criteria for assessing patients and why they want MAID.
The challenge is that the criteria in the legislation actually lack specificity, and they are open to interpretation by MAID practitioners.
Gowron says it's difficult for most people to understand her suffering over the past decades, but she knows she wants it to end.
I know that my condition can't be cured, and I've come to terms with that. I don't want to be helped anymore. I don't want to become somebody's pet project or somebody's experiment trying to fix me.
Outside of court challenges or traveling to a country where MAID for mental health is legal, Gowron feels condemned to a life she can hardly bear for years to come.